We're live.
Assalamu alaikum, everyone. Welcome to another episode of CAIR's The Daily Dose. I'm Danette Zagari-Mass, nonprofit attorney at CAIR. I'm your host this afternoon, and I am joined by fabulous Shaheen Nassar, who is our policy and advocacy coordinator of CAIR California's LA office. So really glad to have you all here today. We have a very important topic, which is reopening, reintegrating, and self-isolating for Eid. We bring you this show every single day during Ramadan at 3 p.m. Eastern time. We'll play it again in the evening. So we hope that you will continue to join us. If this is your first time, welcome. Again, it's Monday through Friday, every day at 3 p.m. Looking at the statistics right now in our CAIR newsroom, we have a new website for you all. It's cairnewsroom.com. And up there, we have the daily statistics to keep you up to date on the COVID-19 situation. In the US, nearly 85,000 confirmed cases of, of death due to COVID-19 reported in the US, and one of the highest per capita in the world. So we're going to talk about that today. There's a lot of fear and nervousness around, reopening, and that brings into kind of this conversation, personal protective equipment. So we have the president of IMANA Islamic Medical Association, which I'm going to bring on in just a second, but I want to say hi first to my co-host, Shaheen. Are you there?
Yes, I'm right here. Pleasure to be here.
How you doing? How you doing today?
Excellent. I'm doing great. I feel honored. I'm very, very happy to be on your program.
From your house, right?
Yeah, from the safety of my house, alhamdulillah.
I know, but you keep rolling. I mean, CAIR's work doesn't stop. CAIR-GLA is full steam ahead, working even harder. I know, because I've been in contact with you guys.
Absolutely. So we have traditional roles of encouraging civic engagement, of providing legal services for civil rights cases, as well as immigration legal services. We policy and legislative advocacy. We're doing so much, but in addition, we actually have some new roles that we've taken. We've sort of adapted to the current situation, and we want to help not only our community, the Muslim community, but the broader community as well, as much as we can during this pandemic.
Yeah. So how is it? I mean, you all were one of the first hit on the West Coast. So you have been dealing with it even longer than the rest of us. And one of the goals of this program is to bring everyone closer to the stories and the people in the community, to bring us together during this pandemic and trial. What has it been like now? How many weeks are you into this isolation and also managing the crisis?
I believe this is week 6.
Week 6, okay. Feels longer.
Week 6. It does. And subhanAllah, like Ramadan, we always say the same thing about Ramadan. It goes by so fast, but I feel like the quarantine exacerbated, it expedited Ramadan even more. So subhanAllah, already in the last 10 days.
SubhanAllah. Yeah, I do feel like I've been in quarantine for a long time, though, longer than, but yesterday here in Maryland, they talked about opening up. Governor Hogan had another press release, and he opened our retail stores up to 50% capacity. And so people here are having conversations around what that's going to look like for each individual family, and personal protective equipment being a really important part of this conversation. What exactly has CAIR-GLA done in this regard for the community?
So actually, it's kind of an amazing story. So what's really impressive, the way that we actually started helping provide the community with PPE, with personal protective equipment, face masks. And the way that actually happened is that AST, a Muslim-owned organization that manufactures and sells T-shirts, contacted CAIR-GLA. They had 3 factories and over 500 staff members. And they were deeply, they were deeply concerned, not for themselves, but rather for their staff members. And so they were worried about this government's decision to shut down non-essential businesses, that would devastate their workers. So in a time of crisis, they adapted like we did, so that they could better help others. Seeing the dangerous lack of protective, the lack of PPE in this country, they wanted to make face masks. So. However, they didn't want to go ahead with that plan without getting the proper approval. They wanted to make sure that their decision to help others was completely legal and approved by our government. So they knew who to turn to. They contacted CAIR-GLA. CAIR-GLA was instrumental in getting the approval for this altruistic venture. We did what we do best, political advocacy and making use of established relationships. So naturally, we contacted the governors, we contacted the cities, we contacted the council members, we contacted the counties, telling them, hey, we have an organization that wants to do good. They want to help. Will you allow it? And that really got their attention. So a lot of these politicians, these officials, they kind of jumped on board pretty quickly. So
we're good at that. And, we know who to contact in a crisis.
Absolutely.
Definitely. CAIR-Georgia was on earlier during the quarantine. CAIR-Georgia was on, and they had a bunch of students that were stuck in Latin America. They couldn't get back over. They had gone there on a medical mission trip, and they were able to get them back home through contacting all the people that we work with already on a regular basis. So that's awesome. So let's go ahead and introduce Dr. Nabile Safdar, who moved to Atlanta in 2014 with his wife and four daughters. When not spending time with his family and colleagues at Emory Healthcare, he enjoys volunteering and supporting local and national nonprofits. He currently serves as the president of the Islamic Medical Association of North America, IMANA, the oldest and largest organization of Muslim physicians in the United States, which has treated over 2.5 million patients worldwide as part of its medical relief mission. Are you there, Dr. Safdar?
I am here. Can you hear me okay?
I hear you very well, mashallah. Sorry about the speech issue. I need water in Ramadan. It's hard to talk at this point, and it's hard to get our words going. But yeah, 4 daughters, mashallah. That's wonderful. What's it like there in Georgia right now, and in Atlanta specifically?
Yeah, Georgia is one of the first states, as you may have read, to have opened up. It was a state that opened up at the governor's decision. Pretty early on, I mean, the recommendations from public health officials have been that we want to see a 14-day downward trend in new cases before recommending easing of the shelter in place or lockdown orders. And so we opened up pretty early on, so much so that even the president at some point had some criticism for the decision that Georgia made. As we go out and about and we look at the data in Georgia, what we find is just because the state is so-called open for business does not mean that everything's back to normal 100%. There has been a little bit of an increase in activity, especially in parks and public places. We're seeing a little bit of a bump in workplaces. But a lot of people are still voluntarily kind of choosing to stay at home if they can. Schools are still being done virtually. The overwhelming majority of masajid in the Atlanta area still have their doors closed. So for the most part, it's a mixed picture. A little bit of an increase, and definitely we're seeing week to week more and more people feeling comfortable getting out there, but not a full-blown 100% increase back to normal quite yet.
So it sounds like even though the government is saying, opening its doors, people are using their common sense and exercising a lot of discretion. Great. Shaheen, are you still there with us?
Yeah. I'm right here.
Sorry. I think Shaheen had a question earlier about. Sorry, go ahead, Shaheen.
Actually, I wanted to ask our guest here. Can you tell us about the National Muslim Task Force on COVID-19?
Yeah, sure. Thank you for that question, Shaheen. So the National Muslim Task Force on COVID-19 really formed very organically in March when there was a lot of misinformation about coronavirus, about COVID-19. There was a lot of anxiety about what this means. And there were a group of organizations that got together, and we wanted to be able to provide guidance from trusted sources. The 4 initial organizations were IMANA, the Islamic Medical Association of North America, our friends at AMHP, American Muslim Health Professionals, ISNA, Islamic Society of North America, and the Fiqh Council of North America. And we put together a statement with some guidance about keeping masajid closed or the importance of social distancing as the number of cases were rapidly increasing. And what we found was that there were a large group of our friends and organizations that were really interested in working together at a national level to amplify this message and to add their expertise. So now the National Muslim Task Force on Coronavirus for COVID-19 has a couple of different task groups, one on policy, of which CAIR is an active member, one on faith and fiqh. We rely a lot on our friends from AMJA and the Fiqh Council of North America, one for social services, groups that you're familiar with like Islamic Relief or Penny Appeal, and also IMANA. A group for mental health, AMHP and other orgs have a lot of expertise there, and a group for health professionals. And what's been great is we can get groups, physicians, epidemiologists, ID specialists together with the fuqaha, the experts in religion and policy and mental health and social services, and get them together and have a good conversation. Sometimes most of the time we agree, sometimes there are things that we need to hash out, but that way we can provide kind of really holistic guidance. First of all, it's purely selfish on my part. I'm a part of it because I'm learning a ton and our organization is learning a ton. And we really enjoy working with the other organizations, but also because it's a really diverse group. There are organizations that are predominantly Sunni, predominantly Shia, all different ethnic and racial backgrounds are represented in the group. And the group has been able to accomplish a lot of things. It's been able to issue guidance statements. This week, we anticipate releasing very soon, if not tonight, then later this week, inshallah, a guidance statement for the community and masajid on reopening as states start to open up again. What are the checklists? What are the things that masajid and individuals should be thinking about, particularly around obligatory prayers at Jummah? The Social Services Committee has been able to do a lot of great things together. IMANA, Penny Appeal, Islamic Relief, and Dar es Salaam were able to follow in your footsteps and deliver 50,000 KN95 masks to 20 hospitals in 5 different states around the country.
50,000. How did you do that?
Well, it's amazing what we can do when you put our ego away, right? You know what I mean? The groups were not looking to get credit. They were not looking to be in charge. We had established relationships which we were able to leverage, and that really helped us to get the 50,000 masks. It also helped that when you're able to pool the resources of these different organizations, you have a much larger order. The cost goes down. And, you know, each of the organizations on the National Muslim Task Force in the Social Services Committee, a lot of them have logistics capability that we were then able to kind of leverage. So someone's got a strong presence in Chicago, someone else has a strong presence in New York City, someone else in Detroit or the West Coast. And that's what really enabled us to happen. You know, it's really great to see now over 40 organizations nationally come together and focus their energy on this. And inshallah, I'm hopeful that this continues afterwards.
Inshallah. Well, with the reopening of states, what is IMANA's position on advising mosques on how to make the decision to resume operations? Last night, when my kids found out about Governor Hogan's proclamation, I was talking about it earlier about reopening, and religious centers are allowed to reopen. Their first reaction was, okay, it's Ramadan, let's go to the masjid, let's go tonight. I'm like, wait, it doesn't even start till Friday. But it was hard for me to tell them we're not, you know, we want to play it safe. We're not planning on going. So I guess everybody's having to make their own personal decision. What does IMANA say about that?
Yeah, I think leaders of masajid have a really big, important task in front of them. And so it is important for them to establish their shura, get their council that they trust. And IMANA's advice goes in line with the advice of the National Muslim Task Force. And we'll be issuing a statement, again, look for it tomorrow or later this week. Here's the big picture. First of all, here's who we trust. We trust AMJA. We trust, which is the American Muslim Jurists Association. We trust FIC Council for Religious Guidance. We trust the CDC for public health guidance. It is important for masjid leaders to figure out who they're going to look to for their sources of information, because there are conflicts between national authorities, state authorities, and public health officials. So just because a state is opening doesn't necessarily mean that it's met the 14-day downward trend in new cases, which is recommended by public health officials. So our advice is to look for those benchmarks that have been established for our own safety, the 14-day downward trend. Right now, even though there are about 40 states considering reopening or in various stages of reopening, only about a dozen states have actually met that threshold. So I'm in a state, for example, that has not met that threshold, but we are open for business, so to speak. So if you feel the safest, and I think the conservative approach, which is supported, AMJA and FIC Council have both given dispensations permissions for Muslims to stay at home, even for obligatory prayers during Jummah, during this time of coronavirus. But if masajid leaders believe that they've met the criteria, the state the officials allow opening and they feel it's safe, then there's a lot of work to be done. The work to be done includes a really thorough strategic and operational plan that looks at a lot of questions. How are you going to communicate to your congregation who's safe to come and who's not safe to come? We still recommend, even when states meet criteria for opening up, that certain vulnerable populations do not come to the masjid. There's got to be staff, such as folks that are over 65 or who have chronic conditions like diabetes, blood pressure, asthma, heart conditions, etc., or who have compromised immune systems. So for them, even if the state is open, even if the masjid is open, we recommend continuing social distancing.
And those in their house, right? Those also in their household, not
that's right.
Thank you for backing up this mom. I appreciate it. I'm going to have my kids watch this.
Oh, I'll tell you, my own mother is angry with me right now because we have limited our visits, and she believes that I am, and she may be listening, sorry, Mom, like she believes we are, purposefully keeping her grandchildren away from her, but it's, we're really, we say that in jest. They understand that this is for their own safety. So we recommend vulnerable populations stay at home, and keeping away from people who may have exposure. Up to 20% of people who have coronavirus may be asymptomatic. So you can't tell by whether someone has a fever or a cough, whether they may have been exposed. And then once masajid open, they've got staff who can check whether people have fevers. They've got to have extra masks on hand to give to people who don't show up with their own. We recommend an entire long checklist, probably beyond the scope of our conversation here, but which I'm happy to share with you later, that includes, logistics like carpet cleaning, recommending people do wudu at home, having hand sanitizer, maintaining distance even during the Jama'ah, 6 feet. And in a lot of states or a lot of jurisdictions, there will still be restrictions on large gatherings. So in some cases, they'll have to have a system through which only 10 people can come to the congregation for prayer. And then how do you decide who's going to come and who's not going to come? And do you have the guts to turn people away when you've met your capacity? So it's not trivial, even if the government says it's safe, for a masjid to say we're ready to go.
I just wanted to say that I found it very impressive that you were able to generate, 50,000 face masks, and it's efforts like yours that actually inspired CAIR-GLA to amass $27,000 to purchase 10,000 masks, which we distributed throughout our local community. So thank you for serving as inspiration. You partially covered this question with what you just said, but I wanted to see, with the number of deaths expected to continue to rise in the foreseeable future, what advice do you give to Muslims, in addition to what you had just said, what other advice would you give for Muslim communities to safely reintegrate as states reopen?
Yeah, so a lot of what we spoke about already focused on advice for masajid and mosque leaders, but there's a lot of personal and family responsibility that I think still bears repeating. And it's stuff that we've heard over and over again. But I think it's important for us to emphasize that, especially now as the temptation to go out and about, and look, there's some paradoxes which are painful. In my state, I can go to the bowling alley, but the masjid that I usually go to for Jummah is still closed. I could go to a movie theater, but the masjid is closed. And that creates some cognitive dissonance, which makes me think, well, maybe the masjid should be open. But personal things that individuals and families can do is to maintain social distancing, 6 feet between people, at least in public, not joining public gatherings that are too large. Most public health officials will still say to limit public gatherings to less than 10 people, and that appropriately spaced 6 feet apart. Public gatherings that are outdoors have more air exchange than indoors. So when there's an indoor gathering, that's even more of a concern. Keep wearing facial masks. Surgical masks the studies have shown that surgical masks and cloth masks will reduce transmission, especially when all parties are wearing them, and combined with social distancing will reduce transmission of viruses, including coronavirus, and really to continue to avoid making any non-essential travel or social visits. These are things that we can still choose to do personally to preserve our lives, to preserve the lives of our loved ones, to avoid being super spreaders. I mean, we've heard of these super spreading events, whether they've been at funerals or choir practice, and there have been, not in the US, alhamdulillah, but unfortunately internationally, Muslim gatherings that have been super spreader events as well, where a large number of people have been exposed to the virus. So there's still a lot of personal responsibility in this. It's not time for us to take the brakes off and say, hey, we're totally back to normal. And we will have to reassure our families, our children, sometimes our parents, or the folks that are more vulnerable in our communities, to say, hey, just maybe take it easy a little bit, and now might not be the time to go out and get your hair did.
But it's hard because, Eid is coming. It's just the first Eid in isolation. A friend of mine sent around a funny meme. It was about a husband and wife in their pajamas, and they're like, this is how everyone's going to spend Eid this year. It's kind of funny, but sad if it actually happens. But it's true. We need to be, even if we're together in groups of 10 or less, even then we need to be socially distant. Even then we need to wear a mask. How is IMANA addressing that? Or is it even talking to that at all? I know you will have partnerships with mental health professionals. Are you putting out guidance in terms of just sort of how to cope with this and how to implement it?
Yeah, it's definitely difficult emotionally and spiritually, and in a number of ways, for us to not be able to enjoy, first of all, Ramadan and all the social activity and the extra ibadah that goes along with just Ramadan routinely, but then particularly with Eid. So it is important for you, we've been talking about protecting your physical health, but I'm glad you brought up protecting mental health. There are resources on the IMANA webpage, on the AMHP webpage, about strategies and methods that you can use to protect your mental health. We have other partners of the task force as well, like the FYI and others, SEMA, the Khalil Center, all have great resources which are available for us to look at, to share with our families about ways for us to, really kind of protect and preserve our mental health. And there are different strategies for that. It include, frankly, reaching out to people that we can talk to about what we're going through, and expressing the difficulties that we're having. We're going to acknowledge upfront, this is a difficult situation. Eid will be difficult. Regarding advice about how to deal with Eid specifically, The FIC Council, again, one of the members of the National Task Force, recently issued a statement specific to Eid about not only the permissibility, but their advice to families, to Muslim families, about observing the Sunnah of Eid, all the Sunnahs of Eid at home, and how to do that, and
Okay.
how. So, and that's on their website, ficouncil.org. That's a resource that I've been looking at and will be advising my family members, my loved ones, and my community about, that, there's ways to do Eid at home. Now, if you're in a community which is really open, really meets all the criteria, then the masjid leaders have a high responsibility to make sure Eid is celebrated in a safe way. That responsibility is on their heads, and I trust them to make the right decisions about how to do that.
And again, they can find the guidelines on your website, right?
Yes,
How do we
those guidelines will be on our website, and as soon as they're issued later this week, they'll be on multiple of our partner websites.
Great. Thanks for mentioning the Khalil Center. We're actually having Rania Awad on tomorrow. So to talk more extensively about that. And it's great to know that you all have so many partners that you're working with. I think it's just beautiful the way that our community has grown, the diversity within it, the way that we're able to come together in times of crises, the kind of leadership, the quality of the leadership that we have that makes it possible to deliver masks and deliver guidelines and advice and connect people to resources. It's even though it's a sad thing that we're all dealing with, when we really try to focus on the positive aspects, the gratitude piece, I'm very grateful that this exists within our community, mashallah. Shaheen, do you have any questions for the doctor here?
Actually, I just had a comment. I thought it was very beautiful the way that you have this sort of synergy between scientific knowledge and Islamic spirituality that I feel like has been represented in our faith for over millennia. And also, I really appreciated how pluralistic you were in including so many sects and denominations, and just in gathering the Muslim community towards this effort.
Inshallah. So Dr. Safdar, if you could put one thing on a billboard, you could have a billboard all to yourself to get a message out. I'm going to put you on the spot here. What would you put on the billboard?
Yeah, it's tempting to use a billboard to sometimes advertise all the good work that the Muslim community is doing, because I think we feel a lot of pressure to represent ourselves in a certain way. But I prefer to encourage people to do good work, to amplify the good work that's already being done. And that would be give your zakat to CAIR, or give your zakat to IMANA, or to any of the great partner orgs that have been in this task force. There's so many great options. Pick what you like, give your zakat to great organizations, and amplify their good work.
Yeah, thank you so much, Dr. Safdar, for giving a shout out to CAIR. Yeah, we are zakat eligible. We're very good stewards of that, and we take really, we take that trust very, very seriously. I know that CAIR California is also part of that zakat eligibility, and it's good to know also IMANA is, because I heard you mention also your own organization. So, mashallah. Well, thank you for coming on today. Appreciate all the good work you're doing. I'm sure that you're probably rushing into a meeting or a strategy session, or maybe even a patient. So really appreciate you taking some time out of your day to really talk to us and help us. I'm going to go onto your website later and look for that guidance document. I, again, want to thank you for backing me up as a mom, talking to my kids about why we can't go straight back to life as normal. So thank you. Thank you so much.
Thank you.
Have a good day.
Thank you, Doctor.
And thanks, Shaheen, for coming on and spending some time with me today. I really appreciate it, and interviewing Dr. Safdar together. I hope that the rest of your day goes well. It's like 3 hours behind, so it would normally be lunchtime right now.
Yeah, it would. Thank you so much for having me. It was an absolute pleasure. And thank you for shedding so much light on the beautiful work that the doctor was doing. I thought it was wonderful.
Okay, everyone. Hopefully you'll join us again tomorrow. Again, we're going to have Khalil Center on to talk about some of the issues and topics that we brought up today, dealing with some of the mental health issues and spirituality, celebrating Eid and Ramadan, and just issues in general around COVID-19 during it's a time that is spiritually so significant for our community. So check us out tomorrow, 3 p.m. Also go to our CAIR website, www.cair.com. You can also find a list of all of our affiliates in there, CAIR California being one. You can scroll down and find them and check out their website. They've got a really good website with tons of awesome information. And we have a new website also, which is cairnewsroom.com. We have a ton of information. We have just the facts. We have an op-ed column. We have an experts column, and we also keep you up to date with the numbers on COVID-19 straight from Johns Hopkins University. So please check that out. Remember us in Ramadan, make dua for us. Inshallah, we're also making dua for you. May Allah make this easy on our community. May He, may He reward all of the good workers out there, all of the people on the front lines in our community, and all people, period, who are really, putting themselves at risk to save others. So with that parting shot, we'll say goodbye and we'll see you tomorrow, inshallah. Assalamu alaikum.